Good afternoon. My name is Morgan Runyons, and the neurological disorder I'll be discussing today is epilepsy and seizures. Epilepsy is a brain disorder in which neurons in the brain send the wrong signal and cause seizures. Neurons are brain cells and usually create electrical and chemical signals to help the human body produce thoughts, feelings, and actions. Seizures are involuntary bodily movements and behaviors caused by neurons being sent faster than normal and all at once. A person may feel weak, sleepy, or confused after experiencing a seizure and may take minutes to hours to recover from one. Although having a seizure is a very serious act, it does not mean that one has epilepsy. There are many types of seizures. Focal seizures come from one part of the brain, and more than half the people with epilepsy experience focal seizures. A person who is experiencing this type of seizure may either enter a dreamlike state or experience twitches or repetitive movements. Generalized seizures stimulate from abnormal neurological activity from both sides of the brain. This can look like people staring into space, stiffening their muscles, or jerking movements on both sides of their body, including arms and legs. Febrile seizures are caused by illness or high fever in children or infants. Epilepsy can affect anyone of all ages, both men and women. In most cases, epilepsy is connected to genetic factors, developmental brain abnormalities, traumatic brain injury, stroke, or brain tumors. Genetic factors play a major role when multiple family members are diagnosed with epilepsy. Some genes may even affect if a person is able to take anti-seizure medication. There are many triggers that can cause epileptics to have seizures. Those include stress, drinking alcohol, dehydration or missing meals, hormonal changes within the menstrual cycle, sleep deprivation, and visual stimulation such as flashing lights. There are 4 different types of epilepsy: absence, frontal lobe, temporal lobe, and neurological epilepsy. Absence epilepsy begin in childhood or adolescence and tend to run in families. Some may experience small moving, such as jerking arms and rapid blinking eyes, while others may experience staring into space. Frontal lobe epilepsy usually occurs during sleep. It can affect the part of the brain that controls movement and cause muscle weakness. Temporal lobe is the most common epilepsy syndrome in people who get focal seizures. These are often associated with nausea, emotion, or unusual taste or smell. Neurological has seizures that can either be focal or generalized and originate from the cerebral cortex or the outer layer. Most treatment for epilepsy include medications, but can lead to surgery if caused by a tumor. When counseling a family or a child with epilepsy, it is important to take client worldview and hear out their concerns with their syndrome. It is valuable to research and become aware of what your client is going through. And it is important to take in the client's spirituality. As a Christian, I believe in God the Father, the Son, and the Holy Spirit. And I know through my walk with Christ, I find peace when turning towards Him in times of need and in times of joy. As we see in the Spirituality and Aging Brain article, research shows that there are positive effects that come from meditation and prayer. Practicing mindfulness, whether in meditation or prayer, helps the client accept what they are going through. It also reduces stress and depression. The Lord can move in mighty ways, and we all have to put our trust and faith actively in Him every day.